Confused about the pathways that you need to get an Ecfgmg certificate? I was as well. Let's talk about it. What's up, guys? My name is Dr. Safo Asante. I'm the successful IMG, successful because I matched, and I'm here so that you can as well. To understand why Ecfgmg has created different pathways in order to get an Ecfgmg certificate, you must first understand what American residency programs want from applicants, and you must also understand what the Ecfgmg's purpose is altogether. So the American Medical School residency programs want applicants that can hit the ground running. By that I mean they already have the basic skill sets in English and clinical skills so that they are in the perfect position to accept the education that they will get in residency programs without having extra distractions so that they can succeed. Residency is difficult to begin with. There's a lot of information that must be assimilated, and you don't want that to be even worsened by not being able to speak English, not understanding the healthcare system, and not having the right clinical skills. That residency is short, so they don't have extra time to teach you all those things. And those are the things that you should have learned either in medical school or after that. Okay, so residency programs from people that can hit the ground running. American residency programs, they select both American medical graduates and international medical graduates. With American medical graduates, it's a little bit easier because they are accredited by organizations in the US, accredited because they meet certain standards. Basically, they speak English, of course. They're already immersed in the US healthcare system, and they also undergo a training curriculum which is acceptable to the accrediting body in the US. Let's switch this. Guys, I don't have my tripod, so I'm holding this with my hands, and it hurts. All right. So that's with the American medical school graduates. Now, with the international medical school graduates, it's a little bit different, right? You go to school in a different country and you're not accredited by the US organization. So you need to be able to prove that you have the qualifications to start residency in the US, that you know able to speak English, that you have the clinical skills, and that you underwent a curriculum which is acceptable. Okay, now this is partly where the Ecfgmg comes into place. The Ecfgmg goes through all those credentials, and they kind of act as a dean's body. They basically go through the schools that you've been through, the USMLE exams that you've taken, to see that you fit certain criteria, and then they give you an Ecfgmg certificate. The Ecfgmg certificate says that, basically tells the US medical residency programs that you are the kind of applicant that has the minimal skills necessary to hit the ground running as a resident if you get into residency. And that's the purpose of the Ecfgmg. Now, they do that by looking at the medical school that you got into, and also the USMLE exams. So USMLE Step 1, the USMLE Step 2 CK, and then the USMLE Step 2 CS. Now, I'm switching my hand again because it hurts. Okay, so the USMLE Step 2 CS is the problem. Ever since coronavirus hit us with a gut punch, everything has changed. With the USMLE Step 2 CS exam was suspended because it's an exam which involves doctor-patient interaction or medical student-patient interaction, and then goes from the point of taking the history to coming up with the differential diagnosis with like the most likely diagnosis. Now we're trying to do social distancing, and that's not possible to Step 2 CS exam, so it's been suspended. Now, the Step 2 CS exam tells people that, one, you can speak English enough to perform your clinical skills in the US, and then two, that you have the clinical skills necessary to do well in residency or to function well in residency. Now, with this suspended, they need to find a different way to show that you have the clinical skills necessary or that you will hit the ground running. And it's a little bit difficult for Ecfgmg. So they created these pathways. Right now, there are 5 pathways. And today is, I would say, today is October 14th. No, today is October 15th. Okay, so as of October 15th, there are 5 pathways. So the first pathway is that you graduated from a medical school and you have a license to practice without supervision in your country. That's the first one. And then pathway 2 is that you already passed a clinical skills exam that's acceptable. Pathway 3 is that your medical school is a part of the WFME, and the WFME is the World Federation of Medical Education. And then pathway 4 is that your medical school participates in the US federal loan program. And then pathway 5 is your medical school offers a degree in conjunction with an American medical school. That's a basic overview. So the 5 pathways. All right, so let's dig into them just a little bit. Not much, just a little bit. Okay, so with pathway 1, basically you are already a practicing physician or you have a license to practice without supervision, which means that most likely you've been to residency and you've taken care of patients under supervision, and they've said that you're okay to practice on your own. Apparently, you need to have gotten your license on or after January 1st, 2015. So if you got your license way before then, you don't qualify for this pathway. And if you don't have a license to practice unsupervised, you don't qualify for this pathway as well. And then pathway 2 is that you have already passed an acceptable clinical skills exam, obviously in a different country. Now, some of the ones which are acceptable are the PLAB, the PLAB, the Australian exam, Canadian exam, and Ireland exam, clinical exam, and some other clinical exams. You can go to the Ecfgmg, the link will be down below. This is more of an overview versus anything else. And then the third pathway, which is straightforward, is that your school is listed in listed or recognized by the World Federation of Medical Education. Okay, so it's on the list for WFME. The fourth one is that your school is listed on the list of schools that participate in the US federal loan program, or they are applying to participate in it, or that they participated in it at the time of your matriculation. Okay, so that's pathway 4. Pathway 5, schools that basically offer a degree in conjunction with a US medical school. For example, Cornell has a program in Qatar and Duke has a program in Singapore. So who suffers with all of these things? Basically, long answer short, old IMGs with long years of graduation. Let's scratch that. Not old IMGs. IMGs with long or old year of graduations. I don't want you to think that if you're older, you have an issue. It's if your year of graduation is way in the past, that's when there is an issue. If you're taking the pathway 1, which is you have a license to practice in your country, the license must have been issued after 2015. Okay? If you are applying with the pathways 3, 4, and 5, which means that you went to the right medical school, then you should have graduated after 2018. And if you're applying to pathway 2, which is that you've taken the clinical skills exam, which is acceptable, then you should have taken that exam after 2018. So basically it's the recent graduates and people that went to the right school, people that have their license to practice in their country, or people that have already taken an acceptable clinical skills exam. Why would they do that? Okay, like I said, the purpose of Ecfgmg is to make the life easy for residency programs, and saying that, hey, this applicant not only has the clinical skills, but also has the clinical knowledge and also the English speaking ability to function well as a resident, to assimilate the information that's necessary. Now, this is a difficult job, okay? So, understandably, they would say that if you've not been clinically active, you've not been taking care of patients in the recent times, some of your knowledge might have dissipated. So you might not be as sharp. So to make it simple for them, these are the things that they picked, and it's understandable, because if you haven't been exposed to medicine in the recent times, you forget stuff as time goes along. Okay, so that's one. And then 2, if you've done a clinical exam recently, you're more than likely able to do a clinical assessment or be able to function clinically compared to somebody who hasn't done a clinical exam. You don't know how that person is going to perform. Okay. Now, the reason why they want recent graduates is, like I said, information is fresh, it's not forgotten, and you're more likely to hit the ground running. The reason why they want people that went to the right schools is because that they know that these schools already have to fulfill certain training regimen criteria, which they do. Okay, so I mean, Ecfgmg's job is difficult, and I guess they're doing the best that they can with these pathways in order to provide people that are graduating now with the ability to still apply to residency without the Step 2 clinical skills exam. Now, anybody that's participating in the pathways has to pass a standardized English exam, which is acceptable. The one which I know is acceptable is the OET. There might be another one, I'm not 100% sure. Check the Ecfgmg website. Okay, so once you pass that, you meet one of the criteria for one of the pathways, then you can get what we call a temporary Ecfgmg certificate. Temporary until you complete the first year of residency. So if you don't get into residency, your Ecfgmg certificate expires. If you don't finish the first year of residency, your Ecfgmg certificate expires. But if you complete the first year of residency, it becomes permanent, which basically makes sense, because if you complete the first year of residency, which means that you did well enough because you have the clinical skills, you have the clinical knowledge, and you can speak English that well, and you understand the American healthcare system. So this is just a basic overview of the Ecfgmg pathways that you can use to get an Ecfgmg certificate. If you watch this video, you can see how difficult of a job it is for the Ecfgmg to say that, hey, you are good enough to be practicing in the US, and that they're trying their best. But anyway, I still have some slots available for my interview prep. So if you were interested in prepping for interviews and doing very well in interviews, just contact me. My information is down below. My email address, my Instagram address, and my Twitter account all down below. Okay? If you're interested in mentorship for this application season, or you want to start mentorship for the next application season, contact me and we'll talk and we'll get you into residency. As always, if you like the video, hit the like button, hit the subscribe button, and hit the notification bell so that you can be notified anytime I release a video. This helps to beat the YouTube algorithm. This helps me be awesome and helps me see that you are awesome. Of course, if you don't like my video, forget you. That's just a joke. I love you all. Dr. Safwa Asante, out.